Hi, my name is Alexis. I'm going to be showing you how to do a catheter insertion for a male. I've already looked over the patient's chart and I double checked the physician's order. I have done the hand hygiene and have the correct PPE. So now we're going to go into the patient's room. Knock, knock, knock. Mr. Jones? Hi, how are you? So today I'm going to be doing your urinary catheter. Can I see your ID band? Okay, thank you. And then do you have any allergies? No, that's good. So I have the lighting's good. I'm gonna adjust the bed to a good height for myself. And I'm going to put down this side rail. So first, Mr. Jones, we're going to do some peri-care. So I'm gonna take your blanket down. I'm just going to expose the area needed, and I'm going to spread his legs, lift his legs up just a little bit so I have more room. And I'm going to take my bath towel. And I'm going to put gloves on. Okay. So I have my washcloth. And I have my warm water. And I'm going to start at the top of the meatus and do circular motions, making sure to rinse and rotate the towel. And then I'm going to go down the shaft of the penis to the pubic area. Okay, and then I'm going to take another towel and make sure to rinse and dry. And next I'm going to remove my gloves and perform hand hygiene again. And so next I'm going to set up my catheter tray. And I'm going to open the top part first away from me, making sure to stay with the outer corners. And I'm going to grab my sterile gloves and put those on. Okay, so now that I have my sterile gloves on, I'm going to set up the area. So I don't need this one. I'm going to take this drape with the shiny side down. And put it over the penis. And then with this drape, I'm going to lay it in between his legs to extend my sterile field. And then now I'm going to take out my tray. And since Mr. Jones does not have an iodine allergy, I can get rid of the hydrogen peroxide. And I'm going to open the iodine and pour it on my cotton balls. And I'm going to open my lubricating jelly and put that also on my tray. Then I'm going to take my catheter and put that in the jelly, as well as I'm going to open the cap for my saline and insert that into the catheter. Okay, so now I'm going to take my forceps, and with my non-dominant hand, I'm going to grab Mr. Jones' penis and take my cotton ball and do circular motions to disinfect the area. Okay, and then now I'm going to take my catheter and at a perpendicular angle, I'm going to slowly insert it into the urethra, making sure that there's no resistance. And if there is, I'm just not going to push, I'm just gonna slightly rotate as it goes in, and I'm going to bring it in all the way to the Y intersection.
Oh, and I'm also going to place the curtains around the side and close the door if possible. So place it in one position, use the head. And then the bed is the chair is locked.
And then with my non-dominant hand, I'm going to grab and inflate the balloon.
Okay, and so if at any time you want to you feel you need a little bit more assistance, you're more than welcome to use this to hold yourself up as well. So then,
okay, and I can remove the syringe and discard of that. And then I'm going to slightly tug, making sure that there's resistance and the catheter is not going to move. And now I'm going to take my bag and secure it to the side of the bed, and I would tape the catheter to the side of Mr. Jones's legs to ensure that it doesn't get pulled on, but making sure that I leave some slack so that he can still move around. And then now I'm going to clean up the area. I'm going to throw all of this away. And then I'm going to take a rag and clean up any excess iodine or lubricating jelly that is on, making sure that I don't pull on his catheter. And then I'm going to remove this drape. And then I would remove my gloves, perform hand hygiene, and we're gonna pretend that's gone. Put the side rail up, discard of this. Make sure that Mr. Jones is comfortable and relaxing. Put the bed in the lowest position. And make sure that Mr. Jones's light is next to him. And on my way out, I will perform hand hygiene again.
Brace your bad knee onto this knee.